bring in a real doctor, no, as much as I admire your comments. Dr. Phil Hammond, who's an NHS doctor. Phil, have you been prescribing these, gardening for people who have got depression?
I don't really think we need to prescribe these things, but there's very good evidence that the daily joys of health, the daily vitamins that keep us healthy, can be summarised in the acronym CLANGERS, and that stands for Connect, Learn, Be Active, Notice, Give Back, Eat Well, Relax, Sleep. Now, if all of us did our daily clangers and encouraged others to do theirs, we would probably halve the demand on health and social care. Not necessarily something that needs to be prescribed, but I work with young people with chronic fatigue, which is a deeply unpleasant condition. And it's as if they used to have Duracell batteries and now they have Poundland batteries. And I say to them, whatever juice you've got left in your battery, try to have 5 portions of fun a day. Try to have little things in your life that give you meaning and purpose and hope. So if I was Health Secretary, which it surely won't be too long now, I'll give it about 5 years, I would adopt a strict clangers for all policy. Everybody needs to connect. We are human animals, we're leaves on a tree. What you're doing this morning is connecting with a wider audience. Loneliness is as bad for you as 15 cigarettes a day. Curious people are happy, healthy people. Learning is strongly associated with health. Activity, physical activity and mental activity, 5 portions of fun. Notice the beauty of the world around you. Give back to others less fortunate. Eat for pleasure, but also eat nutritious food. Relax and wind down before you sleep. And sleep is the biggest of all the clangers. Sleep deprivation kills more people than just about anything, and yet you don't get your 8 hours protected sleep a night. If we did our daily clangers, we'd all be much healthier and happier. I'm saying that as your future Health Secretary.
Positive thinking there.
Phil, I am clangered up. I'm all with you on that one.
Clang it up, I like that. I'm clang it up. Get the t-shirt.
But there is a serious issue here that Yasmin, the point that some people are seriously mentally ill and they need medication, and by prescribing gardening first before maybe they get to the medication, aren't you delaying their recovery?
I think what you need to do is to trust the wisdom of frontline NHS staff. So GPs are very experienced. If somebody is clinically depressed and they might be helped by medication, we try it. If a particular medication doesn't work, we try another. There's a difference between seriously clinically depressed, where medication be life-saving, a bit melancholy, a bit lonely, more mildly depressed, where social interactions can help. So let's leave it to the wisdom of the brilliant frontline NHS staff to decide whether a more social prescription is needed or a pill is needed. But if you're on pills and they're not working for you and you think they're giving you side effects, you must speak up, because they may well be doing that.
Phil, I love your positivity. I love your flowery shirt as well. I've gone for the same flowery shirt. You probably can't see that. Positivity, and we'll interview you when you're the Health Secretary in a few months' time. Thank you very much.
I'll have to beat Jacob Rees-Mogg first, but it won't be too long, don't worry.